we are off, we're often discussing ethics in the private sector, the relationship between management, unions in large companies. We are endlessly in a society conscious of political correctness. This is in many areas an improvement and should be should be and is right for a democracy. Now, in the NHS, there obviously should and must have strict guidelines, ethical guidelines, and I'm not so much thinking of the ethics of a doctor, thou shall not kill and aim to do no harm, and this sort of type of ethic. I'm thinking of ethics of employment, how people are actually employed. And I believe that if these injustices were overcome, the NHS would be a far better place. Now, I'm not suggesting there should be an elimination of human resources. I'm not suggesting there should be an elimination of interview process. I'm not suggesting that there should be any normal and usual practice avoided. But the NHS has a very subtle nuance of both favoritism and injustice, in that almost promotion may, in certain circumstances, be given to friends of friends, that favoritism will be covered up by a certain interviewing process, a certain advertising process for a given job. Now, I don't think it is better or worse out of the NHS, but one feels that the NHS should do its best to look at all ways of being ethical. Now, there will be groups and cliques will have certain prejudices, and this is allowed to function in the NHS by almost a conspiracy of knowing a conspiracy of people who have contacts via schools, previous workplace, so that it is, I understand, mimicking the rest of society. And I'm not stupid or pragmatic enough to think that it can be perfect. But I have known complete instances of complete injustice in the NHS. A non-performing doctor or nurse, because of political correctness, may not be removed from their post. There can be very good people with excellent clinical and research ability not promoted because they are not liked by a given manager or management structure. There can be promotion given even with the old school tie connections. Yes, the NHS seems in essence but to be completely egalitarian. Now, why would we have staff shortages? We have doctors retiring at an early age in general practice and hospitals precisely because they feel there's a big brother asking them all the time and almost accusing them of making mistakes. Now, even the question of asking can be hurtful, and NHS staff are always asked. And this in itself, it may not be an actual attack, but it is an attack. And people in the NHS, yes, they feel undervalued, maybe because of the pay structure, but I don't believe that's the root cause. Most of the nurses, doctors, and other disciplines, from the kitchen staff to the ward orderlies, which I think very highly of in the team, they will be monitored in a way where they almost have to prove their innocence. Now, this seems to be paranoid on my behalf. It isn't, because I was very successful, and in spite of my feelings of injustice and people laid upon. Now, one can be laid upon not only by losing one's job, but being accountable where there's no accountability necessary. So what I think I'm trying to emphasize, there's often cultures in the NHS of blame where there should be no blame, and no investigation when there's obvious blame. And I can give examples of doctors and nurses who have been blameless and forced out of their job by means which are obviously legal. There has to be employment rules. These are perhaps obeyed, but they're manipulated in such a way to eradicate people who are not liked. Now, it's very complex, but this culture, if there was a culture of change and honesty and trust within the NHS, we would retain more staff. Staff would be happier. And then, what would that mean? Happier staff, more retainment, people actually feeling that this is a vocation and dedication. The patients would benefit, society would benefit, and government might achieve their aims.
You talked about people being monitored and kind of like Big Brother, and kind of who are these people who are doing the monitoring if it's not the doctors and the nurses, and who is it?
It is the units will vary and parts of the country will vary, size of institutions will vary, so there'll be complex differences in different situations. But this monitoring is correct, but it's this constant whispering and accusation. Now, who does it? It may be doctors who don't get on. The senior doctor will make life very difficult for their colleagues. That's at one level. Managers are perhaps unfairly blamed for every misfortune, but they too can not understand the clinical need of the patient or the problems of the carers. So they come from an environment. I have known managers who come straight from stores such as Tesco's and Marks and Spencer, and then they're starting managing nurses and doctors and staff in hospitals with no knowledge of the need of either the staff or the patients. And so very often the managers are not to blame because they are that they wish to be difficult, but there's always, and I believe this is true in all, particularly in NHS management, the manager will not stay for years and study their group and a loyalty built up between manager and their staff. There will be a turnover of managers 6 monthly, yearly. They'll be moved round departments without any thought. Relationships are not built. Trust is not encouraged to a great degree because of this constant movement of managers. The managers feel insecure. They wish to be promoted, or they wish to, and promotions very much in their mind, as in banking or in anything else. But in the NHS, if they're to be promoted, there has to be a job often found for them. So they are effectively, probably, it's not undermanaged, the NHS, it's overmanaged, but overmanaged in a way which is not intentional, but not analyzed correctly. So the recruitment of managers because they have a degree or have become from another part of another work environment are employed, they find themselves in dead end, and in the given levels, the turnover is enormous. There's no constancy. So therefore, with no constancy, there's no loyalty. So no loyalty to management, no loyalty from management to the staff. And this, I think, most people in the NHS will understand, even if they cannot vocalize. Why are they unhappy? Why am I leaving nursing? Why am I going from being a doctor to something else? It is this constant change, this constant lack of loyalty, this constant lack of building relationships. And this has changed and getting worse and progressive over the last 10 to 15 years. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.